thoracic surgeon, Dr. Mohan Kulkarni. Welcome back to the show.
Good afternoon. Hi.
Yeah, nice to have you here. I was going to mention, the last time you were on our show, on our Facebook page when we posted your interview, first thing someone said, a comment of your comment said, "He saved my life." That's going to be incredibly rewarding when you see that kind of impact they have in the community.
Well, that's what I love about this community. They're so grateful. They're so much fun to take care of. And, you know, it doesn't get old. I love taking care of them. Yeah.
Well, keep it up.
Thank you.
We're lucky we have cancer care right here in Jackson. What types of cancer are being treated here at Henry Ford, hematology and oncology?
Well, you know, cancer care, comprehensive cancer care was started by Ray Clark, as you know, in Jackson at the Foot Hospital in the 1970s. And for 50 years now, we've been providing great care close to home. We have what they're called disease site teams. So we have a team which is a group of specialized doctors that take care of a particular type of cancer. So I lead the lung cancer tumor board. I lead the lung cancer team, which involves myself, the surgeon, the oncologist, the radiation doctors. Then we have also a team for breast. We have a team for colorectal cancer. So those are sort of the common cancers that we take care of here in Jackson. And we have a great group of oncologists here now. We have 6 of them. We have Dr. Trimble, as you know, Dr. Clark started it. Then Dr. Axelson joined and he's retired. Now we have Dr. Trimble, Dr. Hirth, Dr. Hazy, Dr. Kudva, Dr. Malik, Dr. Granowitz. We got all of them. And they all take care of these patients. We also have 2 great radiation oncology physicians, Dr. Vance and Dr. Kressler. So together we do what's called precision medicine. We take care of them from A to Z.
And this cancer center, we know it as the Gail Jacob Cancer Center, which is right on the main campus.
Yes.
I remember when that opened, got a tour, and I've been back, and it continues to grow. You continue to update with new equipment and new treatments. And I understand recently you've done even more.
Well, we're one of the busiest oncology sites or centers in Michigan with the 6 oncologists that I mentioned. So we have expanded the infusion sites. We have specialty areas. We have supportive services now right on site, palliative care, support for caregivers, because you know somebody has to walk their dog, somebody has to do their shopping when they're going through cancer care. So we have supportive services right on site. And we're excited that we're expanding, which means we can take care of more people at home, close to their home, and provide such specialty care that's really not available in other communities.
Nice. And there is new ways to detect cancer even through blood tests.
Yes, we have Michigan's first comprehensive blood test that can detect multiple cancers. We also recommend that you have your colonoscopies, your mammographies, your lung cancer screenings for detecting early cancers. And those are already here, but we now have a blood test that you can talk to your doctor about.
Are there ways through some more modern technologies like genetics, DNA, AI that you can tell from just a person's biology that they might be prone to cancer?
There are certain families that are at risk. Then you can tell after certain exposures what genetic types are likely to develop cancer. There's so many factors, environmental and genetic, that it's hard to predict with 100% certainty that someone's get a cancer. But you may be qualified for screening studies if you are in a high-risk category.
And if someone does get a diagnosis of cancer that happens to be a cancer that may be one that runs in a family, are there some support services when the because the family's finding out that,
Yeah.
oh my gosh.
Yeah. So we can do genetic testing for a cancer to see what type of precision medicine we can direct at that cancer. But we can also provide genetic counseling for cancers that tend to run in families. And so we have that available now. We can do it.
Someone with a cancer diagnosis, you talk about a team. So do you literally have a group of providers that sit around a conference table and look at a file folder of a person's case?
It used to be a huddle. It's still partial huddle around a table, but now it's virtual as well. So we have a team. For instance, once a week we will meet and go over new cancer cases for lung. And then the pictures are put up, the biopsy results are evaluated by the pathologist, and then everybody weighs in. So based on the cancer type, the cancer stage, and the ability or disability of the patient, we will design a plan of care around that patient, around that cancer, not just the cancer, but the patient and the family as well.
What cancers are you seeing in Jackson? I guess is there a predominant cancer that we're seeing?
We see a lot of breast cancer, we see a lot of colon cancer, of course, and then the cancer that I've dedicated my life to treating, the lung cancer, which is very common still given the risk factors of smoking, and we still see a lot of that.
Have you seen the smoking rates reduce? It seems because of the laws changing where you can't smoke anywhere in public or in buildings, you don't see people smoke like you used to. Are we seeing the incidence of smoking reduce in Jackson?
There is some decrease, but I think it's a hard habit to break, and we're one of the highest percentage smokers in Michigan. So it's still very prevalent, and I urge you to get a screening done for lung cancer if you're at risk.
Are all lung cancers a result of smoking?
No, and this is the part that scares me, because 20% of the lung cancers that I see now are from non-smokers.
20%?
20%. So how do we devise techniques to find those early? You know, it's a hard one. And they sometimes are even harder to treat because nobody's screening them, and they can show up as a late stage.
Do we know what the causes are in the non-smoking population?
Well, check your basement. It could be radon. Radon is very high on the list. Then there are other things like environmental factors, coal mining, mining for uranium, radiation exposure. Those are some of the other ones.
What about vaping?
Vaping, I'm not in favor of that. People use that as a crutch to quit smoking. But then it is so hard to get off vaping. I generally say don't put any crap in the lung. Just keep your lungs clean. Even people that like to have an occasional marijuana, if you will, I prefer that they would not smoke that. Don't put any junk in your lung, because they're precious. You need them for the rest of your life.
If you're going to be a cannabis user, the preference from your health standpoint would be the edibles.
In my opinion, yes.
Okay.
Yeah.
So this cancer center with the new improvements, expanded treatment space, I think you've renovated the whole place too.
Yes.
You're going to have an open house.
We're going to have an open house. We're also going to showcase the Radiation Oncology Center as well with the new expanded patient area. So it's going to be September 23rd. It will be 4 to 7, and you'll meet the doctors, you'll meet the caregivers, you'll also see the facility. There'll be hors d'oeuvres and beverages, and you'll get to talk to the physicians as well.
On lung cancer, you've talked to me about improvements in the way you're able to detect cancer, but I think the last time you were here, you were very specific about you really wanted to see high-risk patients go through the advanced testing, scanning. Is that still the case?
Yes, the low dose CT scans are not much exposure to radiation, but you can still detect early cancers, and if you get them early, you can cure them. So you can take them out and cure them. So once a year, if you're at risk, you should get a screening CAT scan done.
And the risks are those that smoke?
20 years of smoking history.
20 years of smoking history.
Pack a day, and then if you're past 50 years of age.
And so why is that? How do you establish that as I guess the parameter for number of years, number of packs? Say someone's been smoking half a pack for 10 years. Is it not likely that they've developed cancer or will develop cancer?
Chances are a lot smaller, and then you need to, for a screening to work, you need to focus on a high-risk group.
Okay.
And this is a way to detect early cancers. Best bang for the buck, if you will.
How are we treating cancers? Is it surgery? One way, right?
We have everything here. We have surgery, of course. I help with the diagnosis. I help with early cancers. Like I said, we sort of come together as a team and devise a plan that suits best for you. Mm-hmm. And the recipe for that is universal. The same NCCN guidelines that are used here are used at the Mayo, at the U of M, or in Texas, MD Anderson. So they're all, recipes are the same. So we follow recipes based on stage, and now we have this thing called precision medicine where we check the actual receptors that are on the cancer cells, and we direct treatments towards them, immunotherapy. Cancer survival is actually getting better. We've had a reduction in death rates from cancer in the last 5 years.
And I think years ago, and when you first got into the medicine, you were diagnosed with cancer. It was in many cases a death sentence.
Yeah, if you can get it out, great. If not, then your life would be shortened, but it's not like that anymore.
Besides surgery, radiation, chemotherapy,
immunotherapy.
Immunotherapy.
Yeah, that's a new one. Targeted therapies are a new one.
A lot of the, I guess, chemo or radiation make people sick, and people dread that as much as having the cancer. Are they improving those types of therapies?
So this is not the treatment that your grandmother had. This is not the treatment that your father had. Many treatments are done in these infusion centers as outpatients now. Mm-hmm. And we have such a great control on their nausea, their vomiting, and other side effects are minimal. And our oncologists monitor them really closely. So it's not what you have experienced with your relatives in your past. I think it's a totally different era.
Awesome. That's great news. And it's all happening right here in Jackson. The treatments, everything, the therapies, the diagnoses, you stay right here in Jackson.
Henry Ford Jackson. All here. All for you.
On the 23rd, the open house. So from 4 to 7, well, first, for those who don't know where it is on the campus, tell us about where it is, what you're going to be doing, and what people need to know.
So the specialty professional building attached to the hospital, 1100 East Michigan, it's going to be in Suite 307, which is the 3rd floor. That's where the cancer care happens. And you have to RSVP Kristen Trudell by September 16th, ktrudell1@hfhs.org.
And that's it.
That's it. And show up and have a good time and learn more.
Refreshments,
beverages, drinks, hors d'oeuvres, learning, food for your brain.
Fantastic. Well, thanks so much for all the care you provide our community, and thanks for coming in today.
It's my pleasure.
Always nice to see you.
Thank you.
Dr. Mohan Kulkarni, thoracic surgeon with Henry Ford Jackson Hospital.